Hello, it's Dr. Khaleghi, and in today's video, I will be talking about pacifiers. A baby's need for extra sucking is called non-nutritive sucking, and the amount needed varies from baby to baby. It is a way that infants will self-soothe or self-calm. A pacifier can be used for non-nutritive sucking or self-soothing. If your baby is bottle fed, you can offer a pacifier at any time. However, for breastfed babies, it is typically recommended to wait until breastfeeding is established before you introduce a pacifier. So typically around the time your baby is 3 to 4 weeks of age. It's best to offer the pacifier at nap times and before bed. Pacifiers are also shown to decrease the risk of SIDS. You do not want to use a pacifier to replace or delay any meals. It is also important not to attach a pacifier to your child's crib, around their neck, or on their hand. If your baby uses a pacifier to fall asleep, you may need to wake up a few times at night to put the pacifier back in their mouth if they wake up. This, of course, will decrease once your baby is able to put the pacifier in their mouth themselves. When shopping for baby nipples, there are a variety of options out there. It's really going to be trial and error to figure out what type of pacifier your baby likes. For my little one, there are quite a few that we have tried. We've tried this type, which you can also attach a little lovey to. Of course, do not let your child sleep with the lovey due to the risk of sudden infant death syndrome in infants less than a year of life. We also have these types of pacifiers and these types of pacifiers, which are just 3 of the many that are out there. The important thing is to make sure that the pacifier is one piece. There are some 2-piece pacifiers, meaning they will come apart, but that can be a problem for infants or potentially cause choking. You also want to make sure that the pacifier shield, so from here to here, measures 1.5 inches. That way it does not get sucked into your baby's mouth when they're using it, which can, of course, cause choking. It is also important that there are little vent holes on these shields, which you can see in all these different models as well. You also want to make sure that the pacifier you choose has a very soft nipple. Now, it's going to be important to frequently wash these pacifiers or boil them to sanitize them. And you want to evaluate the pacifiers often to look for any type of discoloration or for any breakdown. If you notice this, then it's time to replace the pacifier. Do not use the nipple ring of a bottle cap as a pacifier, because if your baby sucks too hard, the nipple ring can come out and end up getting sucked into your baby's mouth and choking them. I always recommend taking a pacifier with you whenever you are going on an airplane, since sucking on a pacifier during descent can help your little one with any type of ear pain. You should start weaning your infant off of a pacifier between 12 to 18 months of age. Research has shown that infants and children who use pacifiers less or after 12 months of age have an increased risk of ear infections, and children who use pacifiers after 18 months of age have increased risk of dental problems. Hope these tips helped. I'll see you in my next video. Bye.